Good morning. Trying to be a little quiet. It's early in the morning and I'm the only one awake in the house. Before I talked about knowing the data, and yes, this was in context of COVID-19. Now I want to talk about know the models. What are you looking at? What are the results? And where are the risks? And when I mean risks, I mean model risk. One thing I want to talk about though, just to get this off my chest because this is annoying the hell out of me, is there are a lot of people going around who are similar to me in that we know math models, we know numbers, we know statistics very well. However, we are not infectious disease experts. I know I'm not. Yes, I have actually played with epidemic models long ago in teaching math modeling and discrete models and this, that, and the other. I saw why basically everybody got measles, for example, using these math models. Okay, so I know models. Here is the issue, and I have two quotes. One is from Patsy in Monty Python and the Holy Grail, where he says, it's only a model, and it's about Camelot. The other one, though, is all models are wrong, some models are useful. And that's something that actuaries say all the time, and one of my friends now deceased, Carol Marler, used to say this all the time. Models are necessarily simplifications of the dynamic of a system going on, whatever the model is about. I personally mainly use financial models, and so that's really my area of expertise. I used to be in physics, and those were a kind of model of how different things behaved, and they're very, very simplified. All of those math formulas, we have to do it. We don't model every single frickin' atom in every planet and every star to do our orbital mechanics for the solar system. That's not how it works, okay? So usually you start out, it's like Occam's razor. You start out with the simplest model that can explain the dynamics that you see going on. You see how it is different from reality, determine whether that's material and needs to be fixed, okay? So that's for financial models, it's for disease models. I used to do neuron models, so, there's all different kinds of models out there. Just because I have used models, and I love math modeling. I'm a founding member of the modeling section of the Society of Actuaries. I am one of the co-editors of the newsletter of the modeling section. It's called the Modeling Platform. So yes, I'm very familiar with actuarial models that generally are in the life insurance space, okay, life annuities. That's my area of expertise, not even health insurance for me, okay? I don't have that expertise. I don't know. So let's get to the models. Here is one of the models that has been used. It's from the Institute of Health Metrics and Evaluation at the University of Washington. And I want to tell you, they're a good source for mortality trends and info. I just want to show you this really quickly. This is global causes of death, and you see different colors here. And anyway, I don't really like this kind of display. You can choose different displays here on the left. I don't know what's going to give me here, but they are really good. I can do different ages. Unfortunately, they only let me do one at a time. But you can see death rates and that kind of thing. This is global. Anyway, let's just get rid of that. COVID19.healthdata.org is where you want to go to look at their COVID-19 projections. And you can drill down to the state level. I see, so it's April 7th right now. And this was updated early this morning. They have a section on their projected hospital resource uses, all hospital beds and ICU beds specifically, okay, and then ventilators. So you can do different curves. If I do ICU beds, they're going to change the vertical scale so you can see it better, and then invasive ventilators, okay. There is a dashed line, okay, and so that's kind of the average of their projection, and then you see the shaded region that's supposed to give you, the range. It's like a confidence interval, and I don't know if it's 95%. I haven't looked. You can, that's just explaining what they're projecting. Anyway, all resources. So now we have deaths. This one is a little more solid. because you see a solid line here, that's actual historical data. Now, there can be a lag in reporting of COVID deaths, but since it's such a high priority, um, it'll mainly be deaths where someone died at home where we don't actually have the count. So you can see that's a little raggedy here, and then they have a projection, and they have a range. Now the thing is, and then they have a cumulative total deaths, and because this is over time and you're adding it over time, this one is going to be a lot smoother. This is called a sigmoid function shape. And again, there's a wide range. They have predicted total deaths of about 82,000, ranging from 49,000 to 136,000. That's quite a range. Okay, so there's a lot of uncertainty already baked into these models. Where is the uncertainty coming from? So for models in general, and you can get to the results, they actually, what's great is, and then one of the things that I like what they have been doing is with every update, they tell you what's new compared to the prior, and some of it has to do, we are updating based on experience from other countries. So you see the UK, Italy, Spain, and France here. And so they were actually projecting for other countries. Oh, maybe they added that. Because it's mainly what I've been looking here are the states, and I'll show you that. So they have countries, and then they have the update archives, and you can download a spreadsheet. So totally open, totally documenting what they're doing. Anyone can come in here and critique, and I'll get to some of those critiques in a moment. So far, and it's just that I haven't gone deeply searching because, of course, the people who are going to get probably the most hits when I do a search are the ones who are already plugged in, usually because of political coverage and stuff like that. They're generally not where I go to for critique of mathematical models. Oh well. In any case, I like the approach. It's very well documented. You can see what goes into it. You have the results, and you can see how so I can see they added the different countries. So we're in the US right now, and we can go to specific states. I'm going to look at New York and then at Connecticut. So New York, of course, is the state with most cases. And again, we have this peak. You see this solid line that's supposed to indicate capacity in New York State at these different levels. I want to note something here. There are field hospitals being built. So this line could move, but this is what we have as our estimate for what the resources available are. So still it has a projection of exceeding that, but that's for April 8th being the peak. And I haven't heard of the New York State hospitals. Yes, they're taxed, but I haven't heard that they really have to go to these field hospitals yet. Again, it might be because I only have so much time to look at news and all sorts of stuff goes. So 2 days until projected peak of deaths. Now, what assumptions go into the model? And this is what we really need to think about. For deaths, at least they have some numbers they can use. Most of these models are based on what's called an SIR, which is susceptible, infected, and recovered. And I'm sorry, dead is part of the recovered population. But for that kind of structure of model, there are certain assumptions that go into it, such as you won't get reinfected, that once you're recovered, you're recovered. Now, there are types of these models where you can be, quote, recovered and then get reinfected. But that's the whole point and the whole cycle of modeling is you start out with, say, a standard model like SIR. You try to get the parameters, so stuff like the R sub 0, the replication number, of how much it spreads. You have to do assumptions of how long it takes you to recover. And for deaths, of course, the case fatality rate is something you need to think about. Obviously, for hospitalizations, there are assumptions of what percentage of cases need to be hospitalized and then need these more intensive resources. So that's New York. Let's do Connecticut. And I want to do Connecticut for one reason. Well, obviously, up until like a month ago, I was working physically in Connecticut, but it's going to affect me, Connecticut policy and New York State policy, so I want to look. But here is the issue. So here is I want you to look at the numbers here, and I didn't go back to New York, but it doesn't matter. So we have a peak of about 9,000 beds. And then this deaths per day, look, it's very jagged. And we get this really jaggedy pattern that comes out of the model for the confidence interval. This kind of looks weird. And only peaking at like 187 deaths per day and then evening out at 5,000. So the issue here with Connecticut is it's a lot smaller than New York. New York is one of the most populous states in the United States, and Connecticut definitely is not. Oh, great. The peak is projected for my birthday. In any case, these are models. Assumptions go into it. They are trying to communicate that there is uncertainty in what's going on here. But you also see stay-at-home orders, schools closed, non-essential services closed, and dates. That actually all goes into the model. Okay, there's certain assumptions. Maybe those assumptions don't work. All models are wrong. Some models are useful. Yes, these models are being used for decision making, but don't assume that these are the only thing that goes into the decision making. One of the things that influenced was models like this and flatten the curve and all of that. That's a model. But they also saw what was happening in Italy. Okay? Yes, you can't just let it burn through the population because of, more than anything else, the peak in the hospitalizations, and the issue is you have them all coming in at once. All this said, there are critiques coming out of about these models. So let me just get one from Twitchy. Now, Twitchy is very clickbaity, and I know it when I go there. They are just trying to get clicks. They usually get inflammatory tweets and make a little narrative out of it. Okay, so Sean Davis, I'm not going to even look up. So he is critiquing these models. He looks at, okay, what number of people actually hospitalized, and it's very different from the actual number the state of Florida is reporting. Okay, and so I just want to see he is complaining about the hospitalization projections. And yeah, they do seem to, be very off with regards to this. That said, they're treating these projections here as the point, the dashed line, not the entire shaded region. And they really should have looked at the shaded region to indicate how much uncertainty are in these models. They're not claiming that this is the exact trajectory. And again, note that they don't have any historical data points on here. They don't have any real data points on the hospitalization curves, but they do for deaths. So think about that. Okay. So this one is going like, they're doing these models and they change a lot from update to update. And yeah, as the data change, the model changes. There you go. But again, note, none of them are assessing, did these models work with the uncertainty zones? I really don't have time to do this analysis myself, but that's what you should go check. They have everything in there, including the ranges. So you don't need to be misled by the central point on that curve. You can look at the entire range. You can see how wide it is. Did the model updates overlap? Okay, so that central tendency may not be there, and maybe it's biased towards the bottom or the top. Just because it's not hitting in the center doesn't mean the model is grossly wrong. Okay, so here is another one, and they're just saying blah, blah, blah. It's another one. I will put in these critiques, and you can read them for yourself. Comment on the YouTube video, or I think most of these places like it, Twitchy and stuff, you can comment there directly too. But most of these are of the moment. They're from a couple days ago or yesterday, and they go stale very quickly. I actually recorded a version of this video a couple days ago, and there's already been 2 model updates of the IHE IHME model since I recorded that one, and so that's what I'm recording now. But here's the last one. Don't believe the COVID-19 models, and that's not what they're for. What they're for Okay, and this one is from April 2nd. There have been like 3 model updates from this model for quite some time. The whole point of these models is to capture dynamics. It is a tool, and one of the usefulness of the models, and I don't know if this is part of the presentations, is showing the effect, the qualitative effect of different policies. All of these curves are assuming, by the way, that there is the social distancing in all of the non-essential services, and basically that the replication number has been reduced. The problem is, of course, they can't keep people locked down forever. At some point, it doesn't matter what the policy actually says, people will get out. Okay, that's just going to be how it is. Daniel Defoe would have told you that from his experiences in not his, but his uncle's experiences in 1665. Anyone who's ever had to deal with a quarantine situation knows that, yeah, you can lock it down for a while, but after a certain point, you're going to lose control. So at a certain point, there probably will be a second wave. That is my guess. I don't know if that's the case. Everyone's kind of hoping that hot and humid weather will help damp the spread of the disease, and maybe it will. But the whole point here is the models are trying to help us understand the dynamics. If you get too hooked on the very specific, like a single number, and this is a problem I have as an actuary, when we have to report single numbers in financials. Tax people are not that pleased if you give a range of results for a single thing. That said, for stuff like claim reserves, we know there can be actually, depending on what it is, a pretty large range of what we would consider acceptable numbers there. Okay? And there are different reasons you would choose different numbers. There are actuaries right now who have to set up claim reserves for COVID-19. It's health insurance, life insurance, and property and casualty insurance. Okay, they are trying to do the best they can with limited information. We use the less information we have, kind of the more crude models we use, and know that there's a lot of uncertainty built into them. There will be a lot of analyses of these models, of course, once this is all over, and yes, it will be over at some point. But I really recommend, if you want to critique these models, and this is a good model to critique because you can dig into the details. It will give you all of their backup, all of the changes. You can see, and you can critique it based on that. But the problem is a lot of the stuff I'm seeing is they're like, well, this is the number they said, and this is the number that we're getting reported from the state. And they're very different. Yes, they are very different. So you need to think about why that might be. It does not mean that these people are wrong, because that's not how math modeling works. Okay? And yes, maybe these are all wrong, and that can be because the kinds of models they have structurally don't work well for this. I'm not seeing that. I really am seeing that you are getting this kind of shape, so that's not the case. But the case may be the parameterization. If we're using data, say, from South Korea or China to influence how these are modeled, that might be way off from what the dynamics are like in the United States. And that can also differ state by state based on population density, climate, all sorts of things. So there are a lot of places in these models where it can be wrong, okay? That does not mean these models are not useful. So know your models, guys. Bye.